Hi. I was wondering if you ever use ultrasound to look at joint movement before and after treatment.
Yeah, I did. Well, not before and after treatment. I'll use it before. So, like, if I suspect they're not translating and they're stuck and they're joint stuck, I'll just look at it. But I can tell that from palpation a lot of times, so I don't necessarily need to use the ultrasound. The ultrasound's a tool, right? Mm-hmm. It's not diagnostic. And, a lot of the literature that I was looking up is basically saying you're not supposed to use it as a strictly diagnostic tool, which you're not. You have to use your clinical judgment, medical history, all that stuff, in conjunction with your findings with the ultrasound, with respect to, as it's referred to as MSK ultrasound.
So do you use it to correlate what you think is happening clinically and then check it out with the ultrasound? Just
Absolutely, yeah, I can. And I think initially when somebody is getting familiar with ultrasound, you're gonna be checking a lot more things than you will down the road, which is good because you really want to get familiar with how things are moving, what do the different tissues look like, if you have them move side to side or stick their jaw forward, what are you looking at? Yeah, I think, and so from that standpoint, it's a really good learning tool for that, and the patient too. You can even show the patient. So you could use it educationally, like I do often, for things like translation. So you can show them how the bump, that lateral condyle is moving all the way across the screen on one side, and the other side it barely even moves. You say, see that? That's your jaw. It's not really moving. I wouldn't make a diagnosis on that, but it helps to solidify what you're thinking.
Okay, thank you.
Sure.